Good day, everyone. Today's article is titled Diagnosis of Vertical Root Fractures by Cone Beam Computer Tomography in Root-Filled Teeth with Confirmation by Direct Visualization, Systematic Review and Meta-Analysis. It was done by Pradeepkumar and colleagues and was published in JOE in 2021. The purpose of the study was to determine the diagnostic accuracy of CBCT imaging in detecting vertical root fractures in root-filled teeth. The findings were compared against a reference standard, which was direct visualization. As the diagnosis of vertical root fracture is difficult in most clinical situations, and it is usually identified by a combination of clinical and radiographic findings. So they did literature search in different electronic databases for articles published up until June 2020. They included prospective and retrospective clinical studies that used CBCT to diagnose vertical root fractures in endodontically treated teeth, and excluded case reports and in vitro studies. So the study included 8 articles in the systematic review and meta-analysis. The sample size ranged from 10 to 88, and interpreters mainly consisted of radiologists and or endodontists. The reference test, which is the confirmation of vertical root fracture, performed in the included studies were surgical exploration, tooth extraction, or orthograde retreatment. The results of the included studies are not consistent, and the CBCT diagnosis of vertical root fracture was based on different indicators, and so the diagnostic parameters or indicators were not standardized among the studies. They measured the overall sensitivity, specificity, positive predictive value, negative predictive value, diagnostic odds ratio, and positive and negative likelihood ratio through the meta-analysis. CBCT imaging had a sensitivity of 0.78, specificity of 0.80, and an accuracy of 0.86. The positive and negative likelihood ratio were 4 and 0.27 respectively, which suggests that the diagnostic utility of CBCT is weak for both confirming and ruling out the presence of a vertical root fracture. The systematic review and meta-analysis concluded that the evidence indicates CBCT imaging is not a good tool for diagnosing vertical root fractures in endodontically treated teeth when compared with direct visualization. While CBCT may be useful as a diagnostic aid, it is not recommended for a definitive diagnosis. Direct visualization of vertical root fracture by surgical exploration is still considered the gold standard. And thank you.